My dear student, at first we shall discuss about some mammalian experiments. Now, in the previous class, we have discussed the effect of mammalian smooth muscle, and today we shall discuss about the study of variation of blood pressure and respiration on anesthetized mammal under different physiological and pharmacological conditions. Next. Now, introduction. The instrument used is long extension kymograph. This is long extension kymograph. It's a big instrument. Now, there are several parts of this instrument. Two kymographs. This is one kymograph and this is another kymograph. Now, the bigger one, this one, actively moving electrically, and the smaller one is moving passively. A long paper is wrapped around these two kymographs. Now, when this kymograph is moving, the paper is also moving. Now, name of the parts. At first, the kymographs, these two kymographs. Then, U-tube manometer. This is attached with some suitable attachment. Next, control panel. This is control panel. Now, writing plate. This is writing plate. Now, time marker. Here there is time marker. This should be separately shown to you in the next plate. Next, Mary's timbre. This will also be separately shown to you. And some other accessories like arterial cannula, tracheal tube, bulldog clip, and surgical instruments for dissection. This will be shown in the subsequent plates. Now, this is time marker, and you can control the different parameters of the time marker, and with the help of this instrument, time tracing is done. Now, this is speed control device. With the help of this device, you can control the speed, and the speed of the experiment, speed of the drums or the kymographs is kept at a slower rate for the convenience of the experiment. Now, this is writing plate. This one is the writing plate, because the paper is moving over the plate, and if we want to write something, if we want to put some data, we can do it on the plate. Now, this is U-tube manometer. This is the most important part of the whole instrument. Now, this is a glass tube, carved glass tube containing mercury. Here there should be mercury. It's filled with mercury. And there are two ends. This end is connected to stylus, which comes in contact with the smoked paper wrapped around the two kymographs. And the other end having two projections. The upper projection is connected to a reservoir containing sodium citrate solution, and the lower projection is connected to carotid artery with the help of rubber tube. Now, here there is a stopcock with the help of which we can regulate the entry of either blood from the carotid artery or sodium citrate from the reservoir, or we can mix both of these for the experiments, because Sodium citrate acts as anticoagulant so that the blood is not being clotted. Now, there are graduations over here, and there is a scale in millimeter of mercury, but the scale is doubled. Why? Because 1 millimeter depression of the mercury column due to the pressure of the blood from the carotid artery, there will be corresponding 1 millimeter rise on the opposite arm. So the total difference is 2 millimeter. That's why the scale is double, with the help of which we can measure blood pressure, not systolic or diastolic, it is the mean arterial pressure. But this measurement will vary from the actual measurement because of the high inertia of the mercury. This is not used to measure blood pressure, but is used to see the variation of blood pressure under different physiological and pharmacological conditions. Next, carotid cannula. Carotid cannula is a very important part of the instrument. Now, this is made of glass. Now, this smallest and the narrowest portion is connected to carotid artery. A small incision is made on one carotid artery. This pointed end is introduced and is ligated tightly. And the blood is entering from the carotid artery, and through this connection, it will enter the U-tube mercury manometer. Now, the biggest one, that means this portion, is connected with the help of a rubber tube to the U-tube manometer. And this one is kept open. Why? Because from time to time, heparin can be added, and if there is any clot formation, this can be removed through this channel. Now, these two, they are metal clip known as bulldog clip. Now, these two clips are used for clamping the carotid artery. Now, one carotid artery is already blocked. If we block the other carotid artery temporarily, there will be blockage of both the carotid artery, and we are going to see the effect of bilateral blockage of the carotid artery. Now, this one is time marker. It's a copper coil device connected to an electronic machine for time tracing. Now, these two are tracheal cannula, metallic, and there are two varieties. One is Z variety, the other is straight variety. These are for convenience of the introduction into the cannula. Either Z variety or straight variety may be used, and the caliber of this tracheal cannula will be of different sizes, different calibers, according to the size of the animal. If it is cat, the slender one should be used. If it is a dog, the bigger one should be used, like this. Now, a tracheostomy hole is made on the trachea, and the tube is introduced and tied tightly. Now, this is a very unique instrument known as the Mary's tambour. This is made of metal. Now, here there is a cuff which is blocked by a latex diaphragm, and there is a hole here. You can see the hole. This hole is connected to the channel within this metal tube, and this end of the metal tube is connected through a rubber tube to the tracheal cannula and ultimately to the trachea. And over the diaphragm fitted here, this portion, which is known as the stylus, is resting. And in each act of inspiration and expiration, there will be inflation and deflation of the diaphragm, and there will be upward and downward movement of the stylus. The stylus is kept in contact with a smoked paper wrapped around the kymograph, and there will be tracing. There is up and down movement of the stylus will be recorded. Now the procedure of experiment. The animal, we can take either dog or cat. Now the animal is anesthetized with pentothal sodium, 30 milligram per kg of body weight, and it should be introduced not IV but intraperitoneally, because to find a vein for introduction of the pentothal sodium medicine, which acts as intravenous anesthetic agent, is very difficult. That's why it is introduced intraperitoneally. Now, after the animal being anesthetized, some areas are dissected and exposed. What are those? Number 1, carotid artery. Number 2, femoral vein. Number 3, this femoral vein is exposed for introduction of drugs. Number 3, trachea. Number 4, vagosympathetic trunk. Actually, vagus nerve and sympathetic trunk are joined together. That is why this is known as the vagosympathetic trunk. Now, different parts of the instruments are fitted, such as tracheal cannula is introduced into the trachea, carotid cannula is introduced into the carotid artery, and all the necessary arrangement, necessary connection to be done. At first, the normal recording is taken because there are variation of blood pressure under physiological conditions, and that should be recorded first. Then effect of different drugs and pharmaceutical agents should be studied, and then there will be bilateral carotid blocks with the help of the bulldog clip and electrical stimulation to the vagus nerve. The effect of these two maneuver should be studied, and effect of hemorrhage by bloodletting through femoral vein can also be studied. Now this is the normal recording. This is the respiratory recording. This is the variation of blood pressure recording. Now here 3 waves are superimposed. Now you can see small variation of the blood pressure, which is just like sawtooth appearance. This is known as a sawtooth wave or cardiac wave. This is actually the variation of blood pressure in systole and diastole. Now the bigger one, this one, is actually Traub-Herring's wave, the variation of blood pressure during inspiration and expiration. And you can see this is the baseline. Now if we record the tracing for quite a long period of time, we can see that the whole tracing is coming down below the baseline. Again it is moving up, again it is going down, like this. This will go on. And this wave is known as the Mayer's wave. Now this Mayer's wave is produced due to the change of the vasomotor tone during the experiment. The animal is anesthetized and the normal blood pressure is slightly depressed. That means slight hypotension is there, and sometimes this hypotension is corrected, then again it comes down below the normal, again it is corrected, and this will go on. That's why there is production of this wave, which is known as the Mayer's wave. So these 3 waves are superimposed, and this is the recording of respiration, only up and down movement. Now these are the curves to see the effect of adrenaline. Now this is respiratory recording, and this is recording of the variation of the blood pressure. Now at this point, adrenaline was added through femoral vein, and you can see the baseline is increased, the whole curve is elevated, so the blood pressure is increased. And one interesting phenomenon is that in the corresponding point, there is cessation of respiration. And this cessation of respiration is known as adrenaline apnea. Now the cause of this adrenaline apnea is when adrenaline is introduced, there will be stimulation of the vasomotor center, and this stimulatory wave will go to the nearby respiratory center also. But this acts as inhibitory to the respiratory center. That means it is having inhibitory effect on the respiratory center. So the respiration will stop. That's why this is known as the adrenaline apnea. Now, how the blood pressure will be increased if you use adrenaline? Adrenaline having two types of receptor, mainly alpha and beta. There are beta 1 and beta 2. Now, stimulation of alpha will cause extensive vasoconstriction, and stimulation of beta 1 will cause positive effect on heart. Like the heart rate will be increased, the contractility, the conductivity will be increased, and as a result, stroke volume will be increased, cardiac output will be increased, blood pressure, systolic blood pressure will be increased. And due to the vasoconstrictor effect of the alpha, there will be increased peripheral resistance. So, due to this conjoint effect of these two receptor stimulation, there will be tremendous rise of the blood pressure. Now, effect of acetylcholine, administration of acetylcholine can also be studied. This is not shown in the picture. Now, if we add acetylcholine, what will happen? Acetylcholine is parasympathomimetic drug. So the effect on heart will be just like the vagal stimulation. That means the heart rate will be decreased. So the blood pressure will also be decreased due to the negative effect or depressing effect on the heart. And besides this, the peripheral vessels will be dilated. There will be peripheral vasodilatation. So this will cause decrease in the blood pressure. Now, atropine. Atropine is actually a blocking agent for acetylcholine. Now, the effect of acetylcholine is achieved by muscarinic receptor. There is M1 and M2 receptor. Now, atropine actually selectively blocks these muscarinic receptors. So, if we add atropine at first, then we add acetylcholine after some time, there will be no effect of acetylcholine. This proves that atropine blocks the muscarinic receptor of acetylcholine. Now, the effect of beta blocker can also be studied by this experiment. Now, there are two beta receptors, one is beta 1, the other is beta 2. Now, beta 1 and beta 2 both can be blocked by a drug which is known as propranolol. This is non-selective beta blocker. And there are so many selective beta blocker, particularly beta 1, like atenolol, sotalol, metoprolol, nebivolol, etc. This selectively blocks beta 1 receptor. Now, if we use non-selective beta blocker like propranolol, both the beta 1 and beta 2 will be blocked, and there will be unopposed action of alpha. So, after having non-selective beta blocker, if we administer adrenaline, due to the unopposed action of alpha, there will be tremendous rise of the blood pressure. And this happens when a patient taking propranolol for prophylaxis of migraine for quite a long period of time is suddenly excited and there is endogenous secretion of adrenaline. There will be tremendous rise of the blood pressure. Next, alpha blocker. Now, phentolamine and phenoxybenzaimine are two well-known alpha blocker. Now, if you add this alpha blocker agent, alpha will be blocked. So there will be unopposed action of beta 1 and beta 2. Now, after adding alpha blocker, if we use adrenaline, what will happen? Instead of rise of the blood pressure, there will be fall of the blood pressure. Why? Because due to blockage of alpha receptor by alpha blocking drugs, there will be unopposed action of beta 1 and beta 2. Out of this, beta 1 having positive effect on heart, but beta 2 causes vasodilatation, and the effect of beta 2 stimulation is predominant and it takes place earlier. That's why instead of rise of the blood pressure, there will be fall, and this is known as the vasomotor reversal of DEL. Next, vagal stimulation can also be studied. If we stimulate vagus nerve electrically, what will happen? There will be bradycardia, and at one time the heart will stop, and there will be marked fall of blood pressure. But if we go on stimulating vagus nerve, the heart will start beating again at a slower rate, and the fall of blood pressure will be regained slightly, and this is known as the vagal escape. So the phenomenon of vagal escape can also be demonstrated with the help of this experiment. Now, carotid block. Already one carotid artery is blocked where carotid cannula is introduced. The other carotid artery, if we block it with bulldog clip temporarily, there will be rise of blood pressure. Now, what is the mechanism? We are blocking carotid artery proximal to carotid sinus. Now, carotid sinus having mechanoreceptors, and from this carotid sinus, the nervous connection to the vasomotor center, there is inhibitory effect on the vasomotor center. Now, continuously those inhibitory signals are going to the vasomotor center, and which is in equilibrium with other phenomenon. But if we block these two carotid artery simultaneously, temporarily, this continuous inhibitory impulse which is going to the vasomotor center will stop. So the inhibitory effect will be inhibited. That means this will be equivalent to excitatory effect. So there will be rise of blood pressure. And last of all, we can see the effect of hemorrhage. Now, how can we see the effect of hemorrhage? We can allow some blood to come out of the animal's body through femoral vein. Now, this through femoral vein, blood is coming out, so there will be hemorrhage. So there will be fall of blood pressure, hypotension. Now, after some time, you will have to clamp the femoral vein so that there will be a moderate degree of hemorrhage. Now, we can also study that after some time, the fall of blood pressure will regain. And from your theoretical knowledge, you know the compensatory mechanisms of regaining blood pressure after hemorrhage. Now, this is beyond the scope of discussion of all these regulatory mechanisms, but in short, I am mentioning some of them. One is the baroreceptor mechanism, the other is the sympathetic stimulation, next is the renin-angiotensin aldosterone mechanism, and there is mobilization of the blood from the depot, like from spleen and its some other organs, and there is change of the permeability of the vessel, leading to the shift of the fluid from the extravascular to the intravascular compartment. So this will help to regain the blood pressure. Thank you.